Thank you, Mr. Chairman. Members, this resolution declares that the state of emergency relating to the COVID-19 pandemic proclaimed by the governor on March 4th of 2020 is at an end, thereby terminating the emergency powers granted to the governor pursuant to the Emergency Services Act. California has been under a state of emergency for more than 700 days. During that time, local governments have been responding and mitigating the spread of COVID based upon their local knowledge and infection rates. As infection and hospitalization rates continue to drop, it's time for the state to allow local governments to take the lead and address emergencies locally without the shotgun approach of a statewide emergency. It is time that we, as a legislature, heed the advice given to us by the LAO to jealously guard its constitutional role and authority. The governor has slowly begun to peel back mandates indicating that the need for his emergency powers is no longer necessary. If California is truly in a better place to handle future events like COVID, then it should allow emergency assistance to be determined at the local level, just like we do for every other emergency. Government Code Section 8629 provides that all of the powers granted the governor by this chapter with respect to a state of emergency shall terminate when the state of emergency has been terminated by proclamation of the governor or by concurrent resolution of the legislature declaring it at an end. This resolution makes that declaration with regards to the COVID-19 pandemic emergency. The governor has come close, or possibly has, violated the constitutional separation of powers doctrine by legislating through executive order. In fact, the constitutional doctrine of separation of powers between the three branches, executive, legislative, and judicial, in the California Constitution is quite clear and eclipses the Emergency Services Act. Even in times of emergency, strict separation of powers exists between the legislative branch and executive branch of government. Legislating is the plenary power of the legislature, whether in times of emergency or not. One branch of government cannot take on a principal role of another branch of government, a doctrine which, by the way, is reinforced by the Supreme Court. Even the Legislative Analyst Office has recognized this fact. Again, their quote was, "We urge the legislature to jealously guard its constitutional role and authority." So this resolution, SCR-5, is the manifestation of the legislature reasserting its plenary to legislate as well as its constitutional role and authority. Continued lockdowns and the destruction of small businesses is not the answer to solving the spread of COVID-19. The arbitrary nature of who is considered essential and what businesses are allowed to remain open needs to end. There are too many people suffering economically, physically, and mentally, to include our children, as a result of the governor's actions. It is time for the legislature to reassert its constitutional authority as the legislative body of this state and end this endless emergency. One final note is that the COVID-19 crisis has resulted in the most extreme activation of the Emergency Services Act since World War II, if not ever. The Emergency Services Act has not been invoked on such a wide scale in modern times. It was written to address specific types of emergencies like fires, earthquake, war, terrorism, things of that nature. And in fact, in many ways, the Emergency Services Act is obsolete. It was written to address a potential nuclear war disaster where the government and most of the bureaucratic machinations of the state were destroyed or dead. The COVID-19 crisis is no such disaster. The governing bodies of this state are fully functional. The ongoing COVID-19 emergency is a completely different type of emergency than was envisioned when the Emergency Services Act was conceived. So this resolution provides an opportunity for the legislature to reassert its constitutional authority to legislate under the separation of powers doctrine and allow members to express their concerns with the way the ongoing invocations of the Emergency Services Act diminishes the legislative prerogative. This is a good government proposal, Senators. Today I have but one witness, Laura Powell from the Californians for Good Governance. I ask that members please give her your respectful attention. Thank you, Mr. Chairman.
Powell, go ahead. There you are.
Good morning.
Morning.
I'm Laura Powell, representing Californians for Good Governance, a coalition of voters who are concerned about how this prolonged state of emergency is eroding democratic norms in our state. Although we are nonpartisan, many of us are longtime Democrats who now call ourselves politically homeless because we no longer see our party standing up for some of our core values. I personally have been a registered Democrat for 30 years. Senator Dodd, I happen to live in your district. I've never voted for a Republican, but I was happy to accept Senator Melendez's invitation to testify today. The question posed by this resolution is nothing less than whether our state will abandon the separation of powers between three branches of government that is enshrined in our state constitution. This is not a partisan issue, at least it should not be. To be clear, this resolution is not a referendum on any specific public health policies or in Governor Newsom's leadership. The question posed by this resolution is not which policies should be enacted, but who should be crafting those policies. Our state government, like our federal government, is designed to use checks and balances to guard against the inherent danger of any one person gaining too much power. The Emergency Services Act allows the executive branch to temporarily usurp some legislative powers when a crisis requires swift action, but it represents such an extraordinary disruption to the balance of power that it must be limited in duration. The judicial branch so far has essentially punted the issue back to the legislature. According to the 3rd District Court of Appeal, what saves the Emergency Services Act from an unconstitutional violation of the separation of powers is that the legislature has the power under Section 8629 of the Government Code to terminate the state of emergency if the governor refuses to. But if the legislature is not willing to consider in good faith whether the emergency is over, then that safeguard is meaningless. Taking advantage of a crisis as a power grab for the executive branch is far from novel. This has gone on throughout history, around the world, and across the country, as state legislatures and courts have had to rein in the abuse of emergency power by governors across the country. As people who live in a relatively stable society, we often take our democracy for granted, but democracy is fragile. If we normalize suspending our usual lawmaking process for a prolonged period of time, we chip away at the foundation of our constitutional democracy and head down a dangerous path. Each of you has taken a solemn oath to defend the California Constitution. The duty of your office compels you to reclaim the powers that the Constitution grants solely to the legislature. We urge you to put principle above party and vote aye on SCR-5. Thank you.
Thank you, Ms. Powell. Let's continue with any witnesses in support here in the chamber.
Mr. Chairman and members, Paul Yoder on behalf of the Placer County Board of Supervisors, also in support of SCR-5. Thank you.
Anybody else in the chamber? Seeing none, we'll move now on to witnesses waiting to testify via the teleconference service. Moderator, if you would please prompt the individuals waiting to testify in support of SCR-5, we will begin.
Ladies and gentlemen, if you wish to show support, please press 1 then 0 at this time. And we'll go to our first line of support, line number 21. Your line is open. Please go ahead. Line 21, your line is open. Please go ahead.
Next caller.
Next, we'll go to line 27. Your line is open. Please go ahead. Line 27, are you there?
Yeah. Good morning, Mr. Chair and members. Steve Cruz. I'm actually calling in opposition to SCR-5. Is it appropriate at this time?
Moderator, could you just make an
Mr. Chair?
announcement? Go ahead, yes.
Okay, fair enough. Thank you very much. This is Steve Cruz with Cruz Strategies on behalf of the City of San Jose. We're actually in opposition to SCR-4. We believe that it prematurely ending the emergency declaration unnecessarily undermines current state and county programs.
Thank you very much.
Testing,
Thank you. Excuse me. We're in support right now. So I'm asking anybody that's in support of SCR-5 that wants to call and give their name, their location, and whether they support or and their support to call in now. Go ahead, moderator.
Next, we'll go to line number 25. Your line is open. Please go ahead.
Yes, I'm Nicole Young with the Placer County Moms for Liberty, and we are in support of Senator Melendez's SCR-5. Thank you.
Thank you.
Next, we'll go to line 31. Your line is open. Please go ahead.
Hi, I'm Brad Anderson, City of Rancho Mirage, concerned citizen. I'm in support of SCR-5. Thank you.
Now we'll go to line 26. Your line is open. Please go ahead.
You have no reason to cut that at 10 minutes. People are trying to call through. They don't understand the phones. You need to open this building immediately. You need to end.
Next caller.
We have no additional lines for support at this time.
Okay. Thank you, moderator. Having heard from the support, now we'll follow the same process and hear from the opposition. We will begin with Mr. Brian Rice with the California Professional Firefighters, who is here in the chamber. Sir?
Mr. Chair and members of the committee, I want to thank you for allowing me to speak today in opposition to SCR-5. My name is Brian Rice. I'm the president of the California Professional Firefighters. I did a 30-year career right here in Sacramento. I represent over 30,000 career firefighter, paramedics, and emergency service personnel. The last 2 years, COVID-19 have tested the fire service in ways that none of us expected, but the men and women serving their communities throughout the state have stepped up to the task at every opportunity. When providing emergency care during the first waves of the pandemic and the following surges, standing up testing clinics in highly impacted communities, or creating mobile vaccination or testing efforts to reach the most vulnerable Californians, firefighters have done whatever was necessary to keep the residents of California safe and healthy. All those efforts and more were possible due to the flexibility to our local EMS systems, local government, and more by the state of emergency and the executive orders implemented by the state. Just as a pandemic is ongoing and it's an unprecedented emergency for our state and the world, the response to required unprecedented action takes swift and decisive action to save lives. Even as case and mortality numbers continue to improve, the recent Omicron surge and its impacts on the EMS system have shown how critically important these authorities and flexibilities still remain. Ambulances with COVID-19 patients, along with those experiencing other health emergencies, are waiting for hours and hours in emergency rooms on the hall, what we call wall time. And part of this is due to the influx of patients with COVID-19. I'm going to wrap it up, and I'm going to say this is not the time for the legislature to get involved in an emergency as it is winding down. This is a virus that mutates and changes. Our emergency services system is still very impacted, and the flexibility that we get off of the executive orders not only is appropriate, but needs to remain in place, and I would urge you to vote no on SCR-5. Thank you.
Thank you. We'll now move to Catherine Austin Scott on behalf of the California Hospital Association, also here in the chamber. Please proceed.
Good morning. Catherine Austin Scott, representing the California Hospital Association. We represent 400 hospitals plus across the state who have, as our firefighters and partners in healthcare, been fighting this pandemic for over 2 years. As we are seeing, this emergency is not over, as we are seeing. Apologies. Our hospitals have been working in lockstep with our healthcare partners for the last 2 years to meet this crisis. We are facing unprecedented workforce shortages. This governor has put billions into restoring our workforce, retaining workers, because we have lost almost 20% of our workforce. If it weren't for the waivers, the Emergency Medical Services Authority waiver to waive the times necessary for our out-of-state workers to come to this state, thousands of out-of-state workers, we would not be able to serve our patients as we have for the last 2 years. In addition, as our firefighter brethren have said, our emergency rooms are overloaded. Because of those waivers, we've been able to waive space as well as out-of-state waivers and bring in out-of-state workers to make sure that we could serve the patients in those emergency rooms. If this waiver were to be ended today, we would lose those thousands of workers and that space overnight. Patients would be seeing longer wait times, potentially forcing them to wait on care, and unfortunately would result in worse patient outcomes. For this reason, we are absolutely opposed to the elimination of the public health waiver and look forward to a no vote from the committee members. Thank you.
Thank you, Ms. Scott. Thanks to the main opposition witnesses. We will now move to any other witnesses in opposition here in the chamber. We have one.
Good morning, Mr. Chair and members. Karen Lang on behalf of the Napa County Board of Supervisors in opposition this morning. Thank you.
Thank you, Ms. Lang. Next.
Thank you, Mr. Chair. Eduardo Martinez with the California Labor Federation in strong opposition.
Thank you, Mr. Martinez. Anybody else in the chamber? Seeing none, we're going to move now. Moderator, if you'd please open the lines and call the opposition witnesses individually, we will continue.
Ladies and gentlemen, to show opposition, please press 1, then 0. First, we'll go to line 14. Your line is open. Please go ahead.
Good morning, Mr. Chair and members. Andres Ramirez on behalf of Oakland Mayor Libby Schaaf in respectful opposition to SCR-5. Thank you.
Next, we'll go to line 18. Your line is open. Please go ahead.
Mr. Chair and members, Sylvia Solis Shaw on behalf of the City of Santa Monica in opposition. Thank you.
Next, we'll go to line 16. Your line is open. Please go ahead.
Good morning, Mr. Chair. My name is Russell Rawlings. I am the statewide community organizer at California Foundation for Independent Living Centers in strong opposition on behalf of the Disability Organizing Network and the 100,000 disabled individuals served by California's independent living centers annually.
Next, we'll go to line 41. Your line is open. Please go ahead.
Mr. Chairman and members, Andrew Antwi here today on behalf of Los Angeles Mayor Eric Garcetti in opposition.
Next, we'll go to line 19. Your line is open. Please go ahead.
Good morning, Mr. Chair. My name is Russell Rawlings.
Good morning, Mr. Chair. This is Dan Okenfuss representing CFILC. We are the California Foundation for Independent Living Centers, representing a statewide disability rights organization in California, 25 independent living centers across the state. We are in opposition to SCR-5. Thank you.
Next, we'll go to line 22. Your line is open. Please go ahead.
Thank you, Mr. Chair and members. Jean Hurst calling in today on behalf of the urban counties of California, the largest 14 counties in the state, in respectful opposition.
Next, we'll go to line 32. Your line is open. Please go ahead.
Good morning, Chair and committee members. This is Jackie Graywall, Legislative Director with UFCW Western States Council in strong opposition. Thank you.
Next, we'll go to line 35. Your line is open. Please go ahead.
This is Jacqueline Wong Hernandez with the California State Association of Counties, representing the counties and elected county supervisors for all 58 counties, calling in opposition for the reasons outlined in the letter that we sent to committee. Thank you for your time.
Next, go to line 15. Your line is open. Please go ahead.
Good morning, Mr. Chair and members. Marcus Detweiler with the California Special Districts Association. We don't have an official position on the bill, but we were hoping for a few seconds to articulate our concerns on behalf of our special district members.
I'm sorry, sir. Just state your name and your position. So you're taking no position. Next caller.
Next, we'll go to line 40. Your line is open. Please go ahead.
Thank you. Yes, members and Chair. My name is Lorraine Spina from Sonoma County, California, Mr. Bill Dodd's office, representing Save Our Sonoma, and we are in favor of 5, and we missed our call time. Thank you.
Next, we'll go to line 27. Your line is open. Please go ahead. Line 27, your line is open. Please go ahead. Next, we'll go to line 38. Your line is open. Please go ahead.
My name is Christine Fitzgerald, Community Advocate, Silicon Valley Independent Living Center here in Santa Clara County. We're in opposition of the SCR-5. Thank you.
And next, we'll go to line 27. Your line is open. Please go ahead. Line 27, please unmute your phone. We have no additional lines at this time.
Thank you very much, moderator. Thanks to all our support and opposition witnesses. We'll bring this discussion back to the members. Do any of our members have any questions or comments? Senator Nielsen.
Mr. President, ladies and gentlemen of the committee, this is one of the most important bills that will be before the legislature, not this year, but many years. Why? I've complained often here about how the executive branches of government, state and federal, including presidents and governors, have usurped through emergency order and governed through emergency declarations. I remember voting for the bill and reading the bill, as I often do, and it concerned me of no provisions I felt, or too vague of provisions, about how those orders would be extinguished. Well, governors and presidents have figured out how to deal with that. They now have a lot more power. And whose power is it? Not ours, the legislature. Already the governors or the presidents. It's the power of the citizens. And it's time to stop ceding that authority to the agencies of state and federal government and to governors and presidents. This is urgent. We represent about 1 million people, each of us. We are their voices here. Are we going to allow their voices to be silenced? I argue in favor of this bill.
Thank you, Senator Nielsen. Any other members wishing? Senator Allen?
Well, members, I think there's so much that's compelling about this bill, and I understand why people would be inclined to support it. I think that the one problem here is that declaring the emergency over would hinder our ability to do a lot that involves fighting this pandemic. And there's a big piece in the LA Times yesterday about this issue at the national level, and so many of these issues are at play here at our state level as well. It would make it difficult for us to provide free therapeutics, for example, and testing, and all the issues that were raised by a number of the folks who testified earlier today. So I could see myself supporting a significantly limited version of this bill, but certainly not in the form that as it's been presented today, and I'm not going to be supportive today.
Thank you, Senator Allen. Anybody else wishing to address committee? Was that you over there, Senator Wilk? Please proceed.
Thank you, Mr. Chair. First of all, I want to thank you for bringing this bill forward. And it's been a long time in coming, and I know that it had nothing to do with you. I think you're a great chairman. You respect both the majority and the minority members equally, and so thank you for bringing this bill forward. I do have a couple questions for the author, if she's willing to take them. And since it's not the floor, I'm going to ask you. So first question I have, if SCR-5 were to pass today, will anything in this bill prevent the government from taking rapid action in the future should the state experience a surge in COVID-19 cases, hospitalizations, or death?
Through the chair, thank you, Senator Wilk, for your question, and the answer to that is no. There is nothing that would stop this body or the governor from taking action to make sure that any COVID surge that might come at us in the future would not be adequately and appropriately addressed. We still maintain that authority.
Great. Have a follow-up question. Is there anything in SCR-5 that would result in California becoming ineligible to receive emergency federal funding?
Thank you, Senator Wilk. Through the chair, no, there is, I know that the opposition is trying to present this as though we will lose out on all the funding and the resources that we might need in the future if another surge takes place, but that is simply not the case, and I think that's fear-mongering tactics that apparently have worked quite well, but that is not the case.
Thank you. So on my own time, I really enjoyed the debate today because if today was Festivus, I could list the governor's missteps, his overreach, and his secret deals, and I could catalog them all for you, but it's not Festivus, so I'm not going to do that. So to me, this is all about restoring the constitutional balance between the three branches of government. And to say that we can't do that, we just did that yesterday. If you all recall, we didn't like a court case, and we passed SB 118, went to 2 houses, same day, governor signed it the same day. So all we're looking for is to give the people's voice back. One-man rule, I think, has been detrimental to our society, and it's going to have a corrosive effect, I think, long-term on government. And, you know, as we pull away from this crisis, I hope we can look back with less passion and look to see what we did right and what we did wrong so we don't make the same mistakes again. I mean, I think too often in government, that's what happens. You know, we just kind of, like hamsters in a wheel, cycling around. And I think, the world's getting smaller through globalization. I'm assuming we're going to have more pandemics, not less. And we didn't get it right this time. And so we have a chance to at least get back on that road. But I think the more important thing is that we need to fix the things that went wrong this time, because a lot of people paid dearly with their lives, with their loss of businesses, with mental health issues. So again, let's restore the constitutional balance that the framers designed and that has worked well for so many years. Thank you.
Thank you, Senator Wilk. Senator Allen?
Yeah, I do think that it's important that this be ended at some point. I guess that I would like to ask the chair, maybe if one of the witnesses in support or the committee staff could respond to the answers that were given by our colleague about federal funding and about powers that this would roll back in terms of our ability to continue to respond to the pandemic. I would love to get some further clarification information from experts on this, just so we can.
Yes. Either one of the presenters or both, please.
Was there a question? Yeah.
I believe the question, Chair, was whether these would either be continued or definitively ended the federal funding, the waivers we discussed. Was that the question, Chair?
Senator Allen, does that answer?
Well, I would like some clarity on funding, and I also would like some clarity on the extent to which this would hinder our ability to act quickly to respond to changes in COVID, as if there's another surge, et cetera.
So on a couple of issues, if you don't mind, we'll both answer. I'll talk about the hospital waivers, and then maybe, Brian, you can talk about the field. For the hospital waivers, it would end some of our funding because we do get funding through FEMA. It would also, more importantly, end the waivers I discussed related to both out-of-state licensure. That would have to run, that statutory change would have to run through the legislature in record time. The senator did mention that those things have been done, but unfortunately, given the mass amount that would have to be done, the most efficient way to do that is through a public executive order. So both the hospital out-of-state waiver as well as the space waivers, which are critical to, again, the wall time issues, separating patients, particularly immunocompromised patients. And in addition, what I didn't get to mention is we are seeing a lot of patients come in sicker because they delayed care. So while the numbers might be going down, our hospitals and EMS systems are highly impacted because patients waited longer to get their care and are coming in sicker. So the public emergency, the executive orders allow the government to recognize this and pull that into the conversation as well. My colleague.
Mr. Chair, for the fire service, one of the biggest concerns that we would have would be some of the rules and the adaptation of rules that allow us to do certain procedures in the field that potentially could go away at a time when we're still highly impacted by the virus and the patients that need our help. The other one is our ability to assign field personnel into emergency rooms to consolidate patients. Some of these things, we're not ready yet, and we're not ready on the user end. And my biggest concern would be for Californians. Are we able to give the type of care that we need to? Taking it away, it doesn't matter how fast you can bring it back. If you're taking it away when it's still needed, that's not good. That's not good policy. We're not there yet. We're close, but we're not there yet.
Well, thank you. Could I ask the witnesses?
Stand by, please, witnesses.
Do you have? You're asking us to oppose this measure. How long do you think we ought to be thinking about the duration of this state of emergency declaration?
Yeah, go ahead.
If we do turn this down today, what steps should we take? What steps should we be taking to move rapidly toward an eventual rescission of the state of emergency declaration?
Brian Rice from the California Professional Firefighters. I'm on monthly calls with high-level officials in the Department of Public Health, with the Hospital Association, and trying to game this out into the future. And I don't think any of us here are qualified to say when this should end. I think that the governor and Dr. Galley, they have a team in place of medical professionals, medical scientists, and a delivery system across California that we need to follow them. And when they say now is the time, I think we can rest assured and be ready that it's the appropriate time to remove the executive order. I think we need to rely on the leaders that have led us so far.
Thank you. Any other comments, any member? Senator Melendez, before you close, I wanted to offer a couple of comments. First of all, we've heard here about the dialogue and about the debate today, and I appreciate the good, strong debate on both sides. What we can have is a disagreement about, really what's going on. I hear the governor didn't get it right. Frankly, when I look at this and go back and look at 2 years of the pandemic, for one, we had no playbook. Nobody had a playbook on this thing. I think the governor got it right. I think he continues to get it right. And look, it's not that there's no mistakes being made. We're all human beings with no playbook. But if you look at the state of California and how strong the state of California has been, our numbers compared to other states that weren't doing some of the same things, I, for one, am proud of this governor for doing what he did. We all know the impact that COVID-19 has had on our daily lives, and I'm happy to see case rates and hospitalization at low numbers, and we return to normalization of life. However, the existing state of emergency proclaimed by the governor is absolutely important to ensure that the state can quickly and efficiently continue to respond to the COVID-19 pandemic and be prepared for possible future variants and surges. Today, there are 63 provisions relating to COVID-19 state of emergency. 18 of those are scheduled to be terminated at the end of this month, and another 15 at the end of June, leaving open 30 provisions important for maintaining government flexibility. I'd also like to point out that in addition to the ongoing state of emergency, there are currently almost 50 open state of emergencies regarding various situations, including wildfires, drought, tree mortality, and the Oroville Dam spillway emergency. These states of emergency provide the state with the ability to most effectively carry out cleanup, recovery, and mitigation of lasting negative impacts. Further, the legislature has previously conferred authority to the state and local public health agencies to issue orders and respond to and control the spread of transmissible disease. This includes orders from the Department of Public Health, imposing masking requirements and testing and vaccination requirements for certain settings. Thus, if this resolution were to be adopted, it would have no impact on the state and local masking requirements or other public health orders. For those reasons, and for a number of reasons pointed out by various speakers in the opposition, I'll be voting no today on SCR-5, and will ask my members to do the same. With that said, Senator Melendez, would you like to close?
I would. Thank you, Mr. Chairman, and thank you, members, for your comments and your questions and the robust debate. I have a number of things that I need to address in my close. I want to remind you, senators, that there are 29 other states that have ended their state of emergency. Are they all now at risk if there is a COVID surge? Do you think that they have not contemplated what might happen if they have another surge and they don't have a state of emergency in place? 29 other states. So are they all putting their constituents at risk? The other point I'd like to make is that, you know, there is such a thing called a state of emergency declared by local governments. In fact, I had one recently in my own city where we had a fire. We declared a state of emergency, then the state kicks in, and then FEMA can kick in, and reimbursements are made and everyone is taken care of. That's how it should be. And that is still the case today. We don't have a statewide surge of COVID right now. We may not have another statewide surge of COVID. So rather than use this one-size-fits-all approach of keeping the entire state in a state of emergency, why not localize it? Why not allow local communities, if they have a surge, if they're experiencing difficulty with capacity in their hospitals or other services, allow them to declare a state of emergency, and then the state can step in and help, and the feds can step in and help if necessary. But to do so, you know, into eternity doesn't make any sense. I mean, I'm listening to the opposition say, well, they have no idea when the state of emergency should end. They're not qualified to say so. So it goes on forever? Because that's what the suggestion was today, that it just goes on forever until Dr. Gailey or somebody else in public health decides that it's over. There were some opposition letters sent in, and a few of them had some really shocking claims in here that I would like to address, and I know all of you have received these opposition letters. One of the things that was claimed was that pharmacies and pharmacy techs would not be able to administer vaccines and boosters. That is nonsense, and I hope you recognize that. If that were the case, how is it that our pharmacies and our pharmacy techs have been administering flu shots, have been administering shingles vaccination? How have they been doing that absent a state of emergency? We've been doing that. As far as a shortage in California, I thank the opposition for recognizing that we have a shortage of medical personnel in California, and that has been the case for a decade now at least. It is no secret that we have a shortage of registered nurses in California, and we bring them in all the time, and nothing in SCR-5 would prohibit those out-of-state workers from being able to continue to come in and help where necessary. Nothing in this bill prohibits that. One of the other claims made about the space waivers. You know, Senator Wilk, I want to thank you for your comments because you made a point that I was thinking of as the opposition was mounting their claim, that we would suddenly lose the waivers for all of these spaces. Again, nonsense. The legislature could tomorrow introduce legislation to implement these very waivers. There is nothing stopping us from doing that. We did it yesterday, and that was just for enrollment at UC Berkeley. And boy, the legislature went like lightning speed to address that problem. That wasn't even an issue where people's health was concerned. So you're telling me the opposition would have us believe that this body is incapable of doing the same thing when it comes to people's health? Really? Because I take offense to that, and you should too. The other claim that was made, although, I mean, I've got more letters here than I know what to do with, and I can't address all of them. Actually, you know what? I'm just going to go to my close because I could go on for hours refuting the claims that were made, Senator Dodd, and I don't want to do that to you. So I will go to my close, but I will tell you, senators, that I know that the opposition has made some very dire claims in their opposition letters, and I am begging you to see through that, listen to your constituents, recognize this for what this is. This is not a partisan bill. It's just not. Those of you who are on the other side of the aisle, you have heard from your constituents. I know you have because I've spoken with you. And you know that your constituents are fed up with this as well. And just consider for a moment the psychological impact that being in a constant state of emergency has on your constituents, has on your children, has on your healthcare providers. Because you know what? I've got kids in my district who need mental health services. They need to see a psychologist. They are struggling mightily with this. And you know what? They can't get in to see someone to counsel them. They can't go in person to see someone because they're not taking in-person patients because of COVID. So if you remove this barrier, just from a psychological standpoint, my goodness, look at the help that you can be doing for so many of these kids. I'll continue with my close. And I'm not sure what's so funny on this side of the room, but I will continue. I first want to express my appreciation for Pro Tem Atkins and the chairman for setting this resolution for a hearing. It has been a long time coming, and I thank you for that. Senators, this measure, as you have heard me say on the Senate floor, is over 400 days old, and the state of emergency has been in place for over 700 days. In fact, the state of emergency has been extended 3 times since it was first enacted in March of 2020. This resolution is about one thing and one thing only, and that is the balance of power. The balance between executive power and legislative power, to be precise. Many of the groups and individuals who oppose this resolution think that the state's COVID response will come to a crashing halt, and it doesn't work that way. Local government will still have the power to declare local states of emergencies to notify the state that they are unable to meet a potential surge. If a local government feels emergency orders are necessary to tackle an outbreak or triage medical resources, an emergency order by the locals engages state resources. This is precisely how Emergency Services Act works for wildfires and pretty much any other declared emergency. So if we're going to follow the governor's own words of localism is determinative during his smarter press conference, then letting locals decide is what's best. Let's take for a second, let's consider the opposition is correct, just for the sake of argument, and assuming that all of these things come to a crashing halt. Have we not spent the last 2 years preparing this state for the impacts of COVID? Have we done nothing in the past 2 years? Are we caught completely flat-footed? Because that's what the suggestion is. The governor in his State of the State and his smarter press conference ensured Californians that we are ready. SCR-5 does not limit the governor's power to issue executive orders. It just doesn't. If we believe the opposition's claims, they are inherently saying that the legislature is incapable of doing its job, that it's incapable of responding to emergencies or giving communities the resources they need to address critical situations. And I don't believe that, and I hope you don't. Each legislator in the Assembly and Senate agreed at the beginning of this pandemic to grant the governor with the emergency powers to address the crisis at hand, because in the first days of COVID, nobody knew what we were dealing with. Health experts across the country and across the world were attempting to decipher the genetic code of this virus to determine how it worked. We didn't have all the answers. The chairman was right about that. And mistakes were made, and we learned from those mistakes. But we ended school years, and we shuttered businesses, and we implemented lockdowns, and we enforced remote work, and we implemented all sorts of policies and testing. And now, after 2 years of this, we have become incredibly more aware of how this virus spreads and its impacts and its vulnerable communities and the impacts on them. We have grown over the last 2 years. We are equipped to deal with this, and a constant state of emergency is no longer necessary. There is no one in this room here today, no one, who wants anybody to succumb to COVID-19. The suggestion by some of the opposition that that is the case is insulting. What metric, what goalpost, what milestone, what data set is going to be used to determine when this ends? No one can give us that answer. This emergency is not a wildfire. It's not a drought. It is not an oil spill. It is something entirely different. If an emergency situation arises from COVID or any other disease outside of a pandemic, do you think that we can't solve that? Because that's sort of the vibe that I'm getting today. We are elected to represent nearly 1 million people, and we have a responsibility to end this. At the same time, ensuring them that we will be ready and prepared to address any needs that may arise in the future or may not arise. It is time to follow the lead of 29 other states and end the state of emergency. And on behalf of your constituents and mine, I ask for your aye vote. Thank you, Mr. Chair.
Thank you, Senator Melendez. Do we have a motion on this? Senator Archuleta moves the bill. The motion is for the resolution to be adopted. Secretary, please call the roll.
This is file item 4, ACR 5. The motion is for the resolution to be adopted. Dodd.
No.
Dodd, no. Nielsen?
Aye.
Nielsen, aye. Allen? Archuleta? No. Archuleta, no. Becker? No. Becker, no. Vorges? Bradford? Glazer? Wesso?
No.
Wesso, no. Jones?
Aye.
Jones, aye. Kamlager? Melendez? Melendez? Aye. Melendez, aye. Portantino?
No.
Portantino, no. Rubio?
No.
Rubio, no. Wilk?
Aye.
Wilk, aye. Chairman, that has 4 to 6 on call.
That bill is on call. We know where Senator Bradford is. Thank you. Don't we do that? We'll lift the call on the bills and allow those people that are here right now to be able to vote and move on for the rest of their day.
I think I voted on everything. Sorry, I missed your presentation. I had
Secretary, please call the bills.
I got it out.
You want to start with the consent calendar, Chairman?
Yes, please.
Okay, members, this is on the consent calendar. Absent members, Allen.
Allen, consent.
Allen.
Allen, consent.
Allen, aye. Vorges? Bradford? Glazer? Glazer, aye. Wesso?
Aye.
Wesso, aye. Portantino?
Aye.
Portantino, aye. Put that on call, Chairman.
Okay, this bill is still on call. We will now move to file item number 1, SB 846. Secretary, please open the roll on file 1, SB 846.
Okay, members, this is file item 1, SB 846. Absent members, Archuleta? Vorges? Bradford? Glazer?
Aye.
Glazer, aye. Kamlager?
Yeah. So.
On call, Chairman.
Bill's on call. We'll now move to file item number 4, SCR-5. Secretary, please open the roll on file 4, SCR-5.
So this is on file item number 4, ACR-5. Absent members, Allen. Vorges? Bradford? Glazer?
You voted?
Kamlager? On call, Chairman.
The bill's on call. You want to roll that one over? Could we recall the roll on that last bill, please? SCR-5.
Sure. This is file item number 4, ACR-5. Absent members, Allen, Vorges, Bradford, Glazer, Kamlager? No. Kamlager, no.
That bill's on call.
Yes, but we can open it again if you want.
Senator Melendez, please.
Yes. Thank you, Mr. Chairman. I just wanted to request, should SCR-5 not have enough votes to get through committee today, if I could get reconsideration.
Without objection, reconsideration would be granted.
Thank you.
We're going to open the roll on file item number 1, SB 846. Secretary, please open the roll, please.
Yes, this is file item 1, SB 846. Absent members Archuleta, Forges, Bradford, Kamlager. Kamlager, aye. On call, Chairman.
Bill's on call. At this point, we're going to recess this meeting for probably about 5 minutes or so until Senator Bradford returns to the floor. Turns to session and now, in order. The committee is now back to order, so we'll, Mr. Secretary, could you please call the roll? Let's start with the consent items, please.
Yes, this is file item 1, which is the consent calendar. Absent members Forges, Bradford.
Aye.
Bradford, aye. Chairman, that's 14-0. That bill is out.
14-0, that bill is out. We will now move to file item number 1, SB 846. Secretary, please open the roll on file number 1, SB 846.
This is file item 1, SB 846. Absent members Archuleta, Forges, Bradford.
Aye.
Bradford, aye. Chairman, that is 13-0. That bill is out.
That bill is 13-0. The bill is out. We'll now move on to file item number 4, SCR-5. Secretary, please open the roll on file item number 4, SCR-5.
This is file item number 4, ACR-5. Chair voting no, Vice Chairman voting aye. Absent members Allen, Forges, Bradford.
No.
Bradford, no. Glazer, member that, or Chairman that has 4 to 8. That measure fails.
As the Secretary said, that had 4 ayes and 8 noes. That resolution fails. Thank you to all the individuals who participated in public testimony today. If you were not able to testify today, please submit your comments or suggestions in writing to the Senate Governmental Organizations Committee or visit our website. Your comments and suggestions are important to us, and we want to include your testimony in the official hearing records. Thank you. We appreciate your participation.
Just make sure you read.
And for the record, as I had done earlier, I did grant reconsideration on SCA-5. So with that, thank you everyone for your patience and cooperation. We have concluded the agenda. The Senate Committee on Governmental Organization is adjourned.